Hello friends, I am Dr. Mitul Mangukiya, Gastroenterologist. I am practicing at Ayush Gastro and Liver Center since last 5 years and I am involved in the care of the patient with GI disorders. Interventional radiology is the evolving branch, and in the last decade we are doing many procedures which cannot be done by endoscopy. It can be used for controlling the bleeding, it can be used to controlling biliary strictures and other many procedures which cannot be done by the endoscopy. Yes, definitely. India is growing in the IR field also. In the metro cities, most of the advanced center has IR facilities available. Advanced procedures like TIPS, angioembolizations, everything cancer-related palliative cares are being done. Only worry is for the rural areas. I hope in future it will develop in rural areas also. I think all the procedures in IR are innovative, but most of the time when there is a portal vein obstruction, IR can do recanalization and then they can do TIPS. It is most innovative procedures I have been through. If people will know more about the interventional radiological procedure, then people will have chance to select minimally invasive surgeries, procedures instead of bigger surgeries. So patients should know about the interventional radiology procedures. For gastroenterologists, it is essential to collaborate with interventional radiologists because many procedures we cannot do by the endoscopy or by any other less invasive procedure. In that case, IR will come to the rescue, and in that case, IR will be doing wonderful jobs.